and we have to go through this whole ROI snafu between our organization and another organization to get the information we need to effectively treat a patient. So how can technology be used to improve communication and collaboration among healthcare providers, leading to better patient outcomes or clinical outcomes? I think a lot of the focus recently, at least that I've been talking, writing, speaking about in the last little bit, has all been about what technology can do to improve access and communication between clinicians and their patients, or patients and their clinicians or their organizations. But the same holds true for interdisciplinary or integrated clinical care teams. So one of the ways that I just see it being very beneficial to implement some sort of tech tool, software platform, et cetera, that allows clinicians to then share communication more freely. I mean, how many times have you been in the clinic? I come from outpatient private practice world. And how many times do I get a referral for a patient, or the clinic gets a referral for the patient, and we look into it, and it would be really nice to have, I don't know, lab values or imaging or x-rays or something like that. And we have to go through this whole ROI snafu between our organization and another organization to get the information we need to effectively treat a patient. Something like a platform or a portal that can be shared. And this happens a few times with some of the doctors that our clinic works with now, where we get a referral and there's a QR code, and this QR code is a shared EMR, a shared portal where we can drop our notes into it, and the clinicians, the referring clinicians, can drop whatever treatment notes or imaging studies into that portal, and then we can all see it without having to go through, waiting a couple days to get a fax or to send a report or whatever. We get it instantaneously. So things like that really help decision making across the continuum of care, and then increases the access and communication between the treatment team, which ultimately, hopefully, leads to better clinical outcomes in the long run.